So thank you for having me, Abby. And as you already introduced everything, so we're going to speak about emotions, mental health, and fibroids. And when I first did a research on emotions and fibroids, there was really not a lot of information. So very quickly I realized that there is not a lot of stuff around, and people don't really speak about it a lot. And then I was speaking to some of my friends because I couldn't find a lot of information at a time. And then I realized that probably over half of my friends, or at least half of my friends, had fibroids, and I never really had a clue. And that's why I knew that this is very important because people are obviously not talking about it, dealing with it by themselves. So I was very happy to do the research and go through it all and get some information. So I will be covering what are emotions. I always like to start with the basics so that everyone is sort of clear, because sometimes we use words and we automatically think that everyone knows what they are. So I'd like to start with the basics, and I will speak a little bit about women and emotions and how to support and different ways of healing. So what are emotions? So in psychology, an emotion is often defined as a complex state of feeling that results in physical and psychological changes that influences thoughts and behaviors. And when it comes to our body, nothing happens without emotion. When we speak about emotions, sometimes we automatically think about the negative emotions, but we obviously also have positive emotions. So everything we do is linked to emotions, just like everything is linked to our thoughts as well. And the absence of the optimal of emotions can leave you stranded. So if that is not there, or if there's no connection, something will shift, something will happen to your body, either physical, emotionally, mentally, spiritually, or from the soul. And we have fear-based versus love-based emotions, which I sort of already spoke about a little bit. So, the nice emotions, the pleasant emotions, or the unpleasant emotions. And when we focus on the unpleasant emotions, no, we go into this fight, flight, freeze, or friend mode. So this the different parts of the brain that react to how we react to certain things emotionally. So if we go through a traumatic experience or maybe an overwhelming experience, this part of the brain, the amygdala, that will react. It's like an alarm bell. So it will tell you in a very short period of time, because some people think that they have control over it, but it literally goes very quick. It tells you to fight, flight, freeze, or friend. Most people only know about fight and flight, but you also have freeze and friend. So if something happens to you and you feel there is a threat, that part of the brain tells you to fight physically, to flight, to get away from it, to freeze, so your body will numb. Some people can't speak, some people can't move, and people just freeze or they numb. And sometimes it tells you to be friends. So that's more linked to when you, for example, are attacked by someone. And then that part of the brain tells you, well, to come out of this alive, you have to befriend the person. So you might do what the person tells you to do, or you might even make a joke, or do whatever to befriend the person. So the subconscious mind or body automatically responds on thinking, feeling, and acting. When we think something, we will feel it and we will react or behave based on that. And there's two ways of looking at it as well, because there's good and bad of the interpretation of the mind. So when we think about good and bad, I personally don't really like to use the words good and bad, because it's an interpretation of the mind. So you could see things as experience without putting a label on it, for example, or you decide how you experience that experience. And so something might happen and you can decide how you then react to it. But that sometimes takes training, repetition. It takes time to sometimes put that in perspective as well. And it doesn't mean that we can't feel angry, anxious, all of those unpleasant emotions, because the unpleasant emotions, even though, how can I say it, they feel unpleasant, but they're there for a reason. They're not bad. They're there for a reason, that they're there to tell you something. So, and therefore, that's why I don't really want to call it bad in that kind of way, because it's actually a good thing that it tells you that something is happening. It's like, it's an alert to something as well. And you can decide how you then deal with that situation yourself. And only you can decide that, no one else can do that for you. So when emotions get stuck, they become psychological issues for the body, and they can create negative symptoms. And those symptoms can be physical, it can be emotional, psychological, and it can be behavioral as well. So all emotions, good or bad, are a form of an energy, but the negative ones are letting you know something is out of balance. And obviously when you feel the positive, I think most people can relate in general to the positive ones, because it makes us laugh, it makes us smile, makes us feel happy, you're in a good place, and usually then we feel balanced in that kind of way. So the negative ones, again, are not specifically, they tell you something. So if you relate to those feelings in a way like, what is actually happening to me, and connect to them and acknowledge them, more likely you will then start to reduce certain symptoms as well, just by thinking and connecting to that feeling. So what happens when we have unresolved emotions? Because in childhood, or in childhood, when we grow up, we go to situations, we go to experiences in society, and we don't always process those emotions. So if I go back to the fight, flight, freeze situation, for example, those are very good things that we have in place. And because they actually they tell you how to survive. So it's very good to have those things in place. But if something happens to you and you don't really process what has happened, that feeling can come back later on. It can come back 10 years time, 20 years time, 30 years time, because that part of the brain, the brain is called the amygdala, basically thinks that overwhelming situation or trauma is still alive, it's still happening. And that's why people sometimes get triggered at present by stuff that they didn't process in the past. And that's when what they call PTSD, post-traumatic symptoms. Some people get diagnosed, so this post-traumatic symptom disorder, they call it post-traumatic disorder, it's called. So emotional issues carry a powerful charge capable of affecting our biologically in a profound and often undesirable way. So unsolved emotions, emotional issues are often associated with fibroids, gynecological problems, ovarian cysts, excessive menstrual bleeding, because the body must express itself. So when we have unresolved emotions, it's trying to do something, it's trying to get somewhere to be processed, it tries to get out of the body, or it will then stay in the body, and that it will create certain issues for some people. And women have like an additional emotional center. So the uterus, which acts as a portal of accessing emotions. And when we go through stuff, even when people go on stage, they might feel anxious. Or when you're in love, people say they have butterflies. So that area of our body takes a lot of emotions, it holds a lot of emotions. And that's the additional emotional center that I'm talking about. And our emotions are directly linked to our needs and desires. And as women, we are carriers, supporters, mothers, brothers, sisters, not brothers, sisters. And we like to organize, we hold the household together, we do a lot of stuff for other people. And sometimes we forget about ourselves. The amount of time that I speak to women and they put themselves out there and they just forget themselves, or they reach a specific age in their life, the children left the house, and now it's like, oh, what am I supposed to do? Because they don't even connect to who they are anymore. And it can be very scary place to be in, not to know what your needs and desires are. And if you link those needs and desires also to what happens if you don't meet your needs and desires, will you be angry somewhere down in your system, frustrated, or have resentment? Because, and those things are not conscious things that women do, but if your needs and desires are put on hold, at some point it will have a certain kind of effect, because you don't live your full life in those situations. So thinking about that the emotions are linked to our needs and desires and how women are, you get maybe a better idea as well what is happening to that area of us, that additional emotional center that we have. The other thing is that emotions can be genetically passed on. And if you're thinking about Black women specifically, looking at our ancestors and what kind of trauma they have been holding and how that could be passed on to us, because everyone is obviously has a genetic background, doesn't matter what race obviously, but we know that the percentage of Black women is higher than every other culture or race, I should say. So I've been looking a little bit in the research as well, like how come that the percentage is such a big difference. I'm not sure about the figures compared in, for example, the UK or the US, or let's say Europe, US, and maybe the Caribbean and Africa, if there is a difference there or not, to be honest. I still have to look at that. But if we look at our genetic past, then we can see that we are carrying on emotions from our ancestors as well, which can be one of the reasons as well why it could be higher at the same time. So some research say that heavy bleeding is often associated with prolonged internalized sadness and withheld emotions. How often do women hold back their emotion? Even when we look at society, when people talk about the angry Black woman, we're not supposed to be angry, because if we're angry, then we're sort of crazy. So holding in your emotion, not speaking up about certain things, but still doing stuff for other people, all of those unresolved emotions will have impact on your body at some point, if you notice it or not. So we're looking a little bit now at how fibroids can affect your emotions in general. So there can be a fear of the unknown. So fear of the unknown can bring in anxiety of the results, or just anxiety about what is this thing if you were not diagnosed as yet. And if you're diagnosed already, then there is still a fear of the unknown, maybe not knowing what the diagnosis is about and finding all of these things out. And there can be a loss of control, because something has happened to you, you're not sure what it is, and if you do know what it is, it's still a fear of loss of control, because how do I actually get the information? What is happening to my body? Some people's body is actually changing. You might feel hopeless because of the loss of control. And there is physical pain. How do you deal with the pain when you still have to go to work, when you still have to take care of the children, when you're around people, when you go to dinner and everyone is having fun and you're in pain? How do you deal with that pain? And how can that pain now, how's the pain linked to your emotions afterwards? So sometimes we can block pain in the moment, but then it comes back with a vengeance later on. And those emotions might be that you're going to snap to someone without even wanting to snap, because of the buildup of the pain linked into the emotions. The vaginal examination is something that can be very traumatizing for some women, especially if you have a background of sexual abuse or sexual assault, and it's very intrusive. You know, the doctors sometimes are male, not everyone will be comfortable with that. Vice versa, depending on obviously what has happened to you or what the trigger is. But the vaginal examination is also underestimated on how that whole examination can bring worries, doubts, anxiety, and fear just for that one day and going there. There might be fear of growing back of the fibroid. So you might have an operation, but you might still think it's going to grow back. And how do you deal with that fear? Does it bring anxiety? Does it bring negative thoughts? Because we know when we think certain things, if we think negative or if we have doubts or worries, our body will react to it. And if our body reacts to it, our behavior will then be linked to that as well. And then if you're a working person, are you going to take days off sick? How is the employer going to react to that if you're sick every month or if you have pain every month? If you don't have someone who understands, or if you don't have a HR department that understands, then that might be a problem, because you might think that you will lose your job because you're off a lot, or you might push yourself to go to work and sit in this pain. Worries about getting pregnant. I know that there is a myth that, oh, if you have fibroids, you won't be able to get pregnant, but you can get pregnant. But there might be, issues around that. So you might worry about your pregnancy and if it's possible or not. Fear of going back is twice, I see now, so we already covered that one. Treatment decisions. There are so many. There's so much information, especially with the World Wide Web now, right? And treatment decisions. How do you make a decision what to go for, and what information is correct, accurate? What researches has been done, finding out about the research. It's a lot of information that you sometimes can get. And as Abby was saying in the beginning, emotions are not spoken about. So that might be something new as well. And now it's a new thing to think about, So how can I sort of add this now in regards of how I treat myself or how I seek for treatment? So there's a lot of stuff to think about. So there can be a lot of loss of focus, finding out what your pain management system is and how you deal with your pain and how it affects your emotions. Mood swings come out, panic attacks, a lack of self-esteem. So that will be not feeling good about yourself. You might feel helpless, and therefore you will be very irritated, and that will link into mood swings as well. It can be linked to PMS, where some symptoms are quite similar. So sometimes it's challenging to find out, is it linked to the PMS or is it linked to fibroids? But it quite links together at the same time as well, because some women will have more pain when they PMSing or when they have their actual cycle as well. And then it might be a sense of disbelief. Is this really happening to me? And sometimes disregarding from that. So you will disassociate sometimes from the feeling, which could be a pain, could be a coping strategy. And sometimes in a moment that coping strategy might be quite helpful to sort of disassociate from it, because in a moment you have to write this report or you have to take care of your children. But then it's really realizing that, okay, I disassociated from it, but I have to go back to it again, because as I was saying before, if we put our emotions to the side, they will come back at some point. They will come back at some point when you then don't expect it. Insecurity, you start to feel insecure about yourself, about your work, as I said before, about your family life, and you can be in shock mentally, but also physically. And we spoke a little bit about fears before. And then we have the body image. Some people might gain weight. Some people might even look pregnant, because it can grow to that point where it actually might look that you're pregnant or gain weight. If there is the situation that you're not able to have children, then that literally will link into the insecurity, where people might ask you, are you pregnant? And you have to say no, and you want to have children. So all of that together will bring also maybe a feeling of isolation, not wanting to leave the house, disconnecting from people. And then we have feeling unattractive, what is obviously linked to maybe the body language and your sexual function with your partner, because sometimes it can be quite painful to be intimate. Sometimes you don't feel to be intimate as well. And if your partner doesn't understand, that can cause issues in the relationship that you have as well. So a few years after, when I was doing the research again, I found some more information. I was quite surprised. I think when I did my research the first time, I literally found only 3 or 4 links on the website. And this is the World Wide Web we're talking about. So I was very shocked. But when I did the research again, I found some more information, little articles. And this is an article from the Essence magazine. And this coach and doctor is called Denise Haltman, and she says it's easy to connect the dots between emotions and fibroids. Elevated stress levels and emotional cause can cause the energy that runs from the liver through your genitals and lower abdomen to stall. Not releasing emotions, anxiety, and stress can also negatively impact your body's energy levels. When chi, stress, i.e. energy, becomes stuck, blood along the liver channel tends to do the very same thing. So stress and unexpressed hurt can transfer from our spirit to our body. It's sort of confirming what I said before. but I like to share that. So releasing in memories associated with any trauma is a welcome opportunity to allow energy to flow more freely. So it's acknowledging what is going on for you, and maybe expressing it sometimes verbally as well. Not doing not doing so keeps us stuck in a stagnant place, ripe for fibroids. So they can grow, they can, they won't be able to reduce. She also suggests ending the cycle of self-sacrifice with introspection. So look deep into what you're suppressing or experiencing, that you're holding on, that weighs down your spirit. So if you want to see the full article, you can go to the Essence website. It's called Feelings Behind Out Fibroids. So how can people support? Because that's another thing. You might be on this call because you have fibroids, or you maybe want to know more about it. And for family and friends, it can sometimes be quite challenging to support. And sometimes they might not even know, obviously, because people don't actually share those things a lot. But don't be afraid to ask. You can always ask and go with what they basically tell you. If they want to talk about it, they talk about it. If not, hopefully they will be able to tell you. And give them time, because it's a very sensitive topic. Not everyone is really able to speak about it as well. So go with their pace, but let them know that you're there. And be aware of the signs that we have discussed. So if you see that people are more snappy, or women are more snappy, or there's a period of time that, they don't really, that they isolate a little bit more, they don't really want to do specific things, if they, call less or engage less, if there is a shift, again, don't be afraid to ask. You can only ask, and create time to talk. So if they're able to talk, create time for that, or a specific space for that. It doesn't always have to be someone that is a counselor. It doesn't have to be a counselor specifically. Show empathy and go on their pace. So be patient as well, and discuss what they need, because everyone is different and needs different things as well. So really show patience and go on the pace, and ask them what they literally need. And I give them space again on it. Yeah. And I just wanted to put something down about lockdown as well. So because obviously I'm not sure how it is where you are, but lockdown in some countries there's still lockdown. Some countries there's no lockdown, but lockdown had a big effect on women with fibroids as well, even beyond the emotions of it. So it's just to bring to your awareness if these are certain things that you notice during the lockdown that you went through. So extra challenge to express your pain while around others in the household. So how to manage your pains around the household, because in lockdown, a lot of people were obviously in the house with the family. Normally you might go to work, or you might do an activity. You're not in the house 24/7. With lockdown, you're just in the house. So it's difficult to manage your pain, maybe. Normally you might just go out and you're busy, so you can disconnect from it. But if you're in the house for a long period of time with people around you that also sometimes don't know, it can be quite challenging to sort of hide the pain or be how you want to be. So challenge to express emotions about around others in the household. So I see that's a double one. I don't think that is the right slide, to be honest, but okay. So coping strategies are not available because of lockdown, and the gym is closed. You can't do your meditation classes. Not everyone likes to do it at home. Some people go to classes. You can't go to therapy maybe. And your coping strategies are basically out of the window. And how do you sort of get back to that? Your food routine maybe is out of the routine as well because of lockdown, and it's restrictions with shopping, and that can create stress. And when we stress, when we have doubts, then our body will react to it. So your normal support system is slowly breaking down, and there's lack of motivation because you're not able to use those coping strategies. So it's really looking at if you recognize any of the points, and seeing how you can sort of shift it to create those new coping strategies to adapt to the new situation. So the household might depend more on you because you're home more, and there's an expectation of taking care more of the family members as well. And therefore, you might have more mood swings because your coping strategies are not in place, and you're feeling more exposed because people might not know, your condition, and you have to keep up appearance as well. And you might not be able to go to hospital appointments because appointments are cancelled. The hospital can't cope with, the number of people that they have to deal with. And if you can't go to your appointments as well, how do you then take care of yourself? So no support available, or less supports available, services not available. So the fibroid will react to the stress. So it can mean more pain, more bleeding as well. So it might be that you cancel your appointment yourselves because of the fear of going to the hospital, the fear of maybe getting COVID yourself as well. So therefore, you might cancel appointments, and that can be a risk as well. So it's taking that into account. So we're going to the part now where we're going to talk about what you could do for yourself. So you can educate yourself about your condition. So this is part of that as well, finding out about your emotions and fibroids. So finding out about your condition and seeking the right support from the people that you connect to or that have a good background in regards of fibroids, that they know what they're talking about. Obviously, they have to be professional. They don't have to be professional specifically, but you need to know that there is a background that you can trust, that the information they give you is, it can support you and is good enough. You can do some relaxation or breathing techniques. So, centering yourself, grounding yourself, and giving your mind and your body some space and air to just be, and just, even if you do the breathing exercises, sometimes thoughts might still come in, but that doesn't matter. When we do meditation and breathing exercises, some people think that, oh, I need to do it because my mind has to be blank. And that's not the case. Bring the thoughts into the meditation. It's okay for the thought to come in. If a thought comes in, just notice what it is and let it go out again, and just do whatever you do. So make it part of it, and don't get stressed about, oh, I can't think, I can't focus. That can be part of it, part of it all as well. And the more you do these coping strategies, the more your body will recognize what you're doing. So I always use the example of commercials. So people in marketing know how the cycle works. So the supermarkets are literally built based on our psyche. You go in the supermarket, they all have the same layout because they know that will have effect on how you buy. So when you know this information, it's the same as they say that if you watch a commercial, I can't remember the number anymore, but if you watch a commercial, let's say 9 times in a few hours, your brain basically registers it. It's just there. If you like it or not, it's there. So therefore, we know that the amount of time they're pushing those commercials to us is obviously because they want to buy, they want us to buy their stuff. But it's realizing that they're using this technique, and you can use the technique as well because it's free. So why don't you use it to your advantage and use it to your own benefit as well? So the repetition of your coping strategies is very important because you're reframing your brain to understand that, okay, we're not going to think negative, or we're not going to worry, or we're going to relax now, and your body can get used to it, and your brain can adapt to that, to a new system. I always say, make a profile of yourself. So look at yourself in a holistic way, because I usually I work holistically. I look at everything when people come to me. So I look at the emotional, psychological, physical, behavior, work, food, sleep. I look at it as a whole because it's all linked. So if we make a whole profile of ourselves, we get to know ourselves better. And if you get to know yourself better, you know exactly what your body tells you, because your body is always talking to you. So when we have a headache or stomach ache, it tells us something, and it doesn't have to be, oh, I'm in pain. What is my body telling me? When we have our gut instinct, we know, if you're connected, you know what is your gut instinct or what is your emotion. So you know how to act. So you know what your body tells you. So with the relaxation and breathing techniques and the grounding, we can get to that point to sort of really sit and sort of acknowledge what's going on for us without any judgment, without any negative things. If there is pain, you just acknowledge that. If there is happiness, you acknowledge that. If there is sadness, you acknowledge that. It's all you need to do, just acknowledge that it's there. Some people like writing as well. They write their thoughts, they write about their pain, they write about the happiness, they write about, all of these things, and they can be able to see themselves sometimes in a different way when they write it down. So you could write about your pain and let it go like that. And you could obviously write about something positive to uplift yourself. So writing, you can use in a very creative way to sort of, process and heal and recover. So talking to partners, friends, family can be helpful. It's very good to talk in our community. We like to talk, but not on that level. So sometimes it's very important to speak how you feel. Finding at least one person that you can trust, that you can just speak about how you really, really feel without feeling judged. Doesn't mean that you have to speak to everyone. If you have one person that you have that space of trust, can be very, very helpful just to speak about it. It might feel very awkward in the beginning. It might feel very stressful. It's sometimes afterwards, it might still feel stressful as well, because not because you talk immediately, it will be released all the time. But when we speak out words, it's very healing as well. We can create positive thinking techniques. So it's about recognizing your negative ones, monitoring that, and then basically analyzing it a little bit and monitoring that. So if a negative thought comes in, you can ask yourself, okay, why am I thinking negatively about it? So like if you have any doubts, worries, or even anxiety, you can literally say, I'm gonna focus this week on one negative thought. As soon as a thought comes in, you say to yourself, okay, why am I thinking about this? Is it because someone said something to me? Did I hear something? Is it because I'm in pain? What is going on? And then we can rate how much we actually feel emotionally. And then we can ask ourselves, okay, if this is a negative thought, is this true? What proof do I have that this negative thought is true? Especially when it comes to insecurities, we tell ourselves loads of stuff, we tell ourselves loads of lies. And when you then catch yourself to it and ask yourself the question, is this true? And what proof do I have that this is true? Most of the times we don't have any proof. Those negative thoughts comes from the past, things that people say to us, things that we obviously say to ourselves, and catching yourself on that and then trying to change that around can be quite powerful. So realizing that negative thought is not even true can already shift yourself to say, actually, I'm going to say the opposite to myself. Or I'm going to find another sentence to say to myself that is actually positive and not negative. So you can monitor your negative thoughts, for example, for a week or two. You have to do it at least a week or two, at least 2 weeks, because you need to do it a few times before your brain understands that, no, we're not doing this anymore. Because a lot of negative thoughts that we have are linked to stuff that we know in the past, literally in the past. And the past can be a year ago, 10 years ago, 20, 30 years ago. It doesn't have to be specifically in childhood as well. It's things that we experience sometimes, that we tell ourselves certain beliefs. And our belief is really something that we tell ourselves that is true. And if we tell ourselves that is true, then we will react to it. And the magic about that is that if we can tell ourselves that something is true, we can change the belief to something else that is actually something that makes us smile or makes us feel better. Again, something that you have control about yourself, but it needs intention, consistency, and repetition for it to work. So holistic lifestyle, I spoke about it already. So looking at all of those different parts in your life, putting it all together as a whole, because nothing works without the other. It all always works together. There's no way that it works separately. Talking therapy can help. As I said, friends, family, partner, that can help as well. But if you work with a professional and they know what they're doing about, that they know what they're talking about and they have the experience, they can help you to create all of these coping strategies and put it together in a very structured way, and you have a space that is safe, not judgmental, and also you can leave it there. You know, you can go to therapy, get it all out, process it, you can leave it there. So when you go home, there's no one around you that maybe let you think about that. Sometimes it's easier to speak to a third party, to someone that doesn't know you at all, know anyone that you know. So it's your own space. And then healthy eating, I'm sure that is covered or will be covered as well of part of this series. Healthy eating is definitely part of the holistic lifestyle, that you eat properly, but also sleep properly as well, because sleep is sometimes also underestimated. I don't think it's not on this one, but sleep is very underestimated sometimes, because we need a lot of good sleep. And when I say a lot, I don't mean specifically long hours. Everyone sleeps different hours, but if we don't sleep properly, you will wake up with a lower energy. You will be more snappy. I use the example of the bus usually. Like if you wake up and you didn't sleep properly, your energy will be low because you're tired. So when you go to the bus stop and you miss the bus, you might burst into crying because you're like, it's too much. But when you sleep properly and you wake up with more energy, you miss the bus, you might say to yourself, oh, the next one is coming in 10 minutes. It's fine. You're not really going to take it on. Again, to do with perspective in one way, but also thinking about if you don't have enough sleep or not the good enough sleep, it will affect your day. And if it's on a long term as well, it will have a repetitive action on your life on a long term as well. So it's taking into consideration that sleep is very important as well, next to the eat and everything else that I said. So I thank you for listening. This is the end of the presentation. And these are my details if you want to take it down. But if you have any questions, then please, you can ask me now.
Wonderful. Thank you so much, Olivia, for your presentation. We really appreciate it. A lot of food for thought there around how fibroids can affect women's mental health. So does anybody have any questions or comments for Olivia? So you can either raise your hand and I can unmute you, or you can put your question in the Q&A, or if you have any comments, you can put your comments in the chat. So any questions for Olivia? Any questions?